Niger State has inaugurated its State Steering Committee, SSC, and Program Implementation Unit, PIU, for the scale-up and launching of Immunization Plus and Malaria Progress by Accelerating Committee and Transforming Services known as Impact in the states. Honorable Commissioner of Ministry of Primary Healthcare, Dr. Ibrahim Ahmad Dangana, who chaired the inauguration on behalf of Niger State Govt at Ministry Conference Room, tasked the committee on timely delivery of their tasks. The report. Honorable Commissioner, Ministry of Primary Healthcare, Dr. Ibrahim Ahmad Dangana, on behalf of Niger State Govt, who chaired the inauguration of the State Steering Committee on the implementation of Immunization Plus and Malaria Progress by accelerating coverage and transforming services known as Impact in the state, tasked the committee to be proactive in delivering their distinctive roles for scale-up of the activities in earnest in the remaining few months before the elapse of the project. He then commended Governor Mohamed Bago's efforts to secure Niger State for the project.
An inaugural meeting of a very important committee for a very important project in the healthcare sector, which is being co-founded by the state government and the World Bank. It is known as the Impact Project, which largely wants to accelerate our coverage of immunization across the state and to eventually also reduce maternal morbidity and mortality, including childhood mortalities. So today we had an inaugural. The committee had earlier been inaugurated, but we are holding an inaugural meeting of this State Steering Committee. It is multi-sectoral with partners drawn across very important MDAs in the state, including health, finance, budget and planning, information and public strategy, and local government affairs. And also for accountability, we have representatives from our key partners in the state, the WHO, UNICEF, and a coalition of civil society organizations all have representatives on this State Steering Committee.
Impact Project, according to the State Program Manager, is a World Bank assisted project that has a significant investment in Nigeria health sector to strengthen healthcare system by improving quality of immunization, child, neonatal and maternal health towards combating maternal and mortality. Pharmacist Hamza Tijani Yahya, the program manager for the State Impact, noted that Niger State Impact will focus only on immunization activities and, most importantly, rehabilitation of healthcare facilities.
And FCT to provide more effective and reliable service.
The State Steering Committee consists of various key implementing partners from Ministry of Health, Finance, Budget and Planning, Information, Ministry for Local Government, Traditional Institution, Political Office Holders, CSON, who also had this to say shortly after their inauguration.
The idea behind this particular project is to see that healthcare indicators, specifically the number of healthcare indicators, which maternal mortality, infant mortality, polio coverage and others are actually improved so that morbidity and mortality can be reduced both across board, in children specifically, which is a target. So we're sure that this improvement in health status based on some of these projects that are going to come will actually ensure that there's development that is faithful to the state.
We're the coordinators of all partners and that comes to Niger State. All partners, be it UN, be it EU, be it CSO, NGOs, all were the coordinators of all partners. So and that is why we're part of the team, and we also want to make sure that things are done on the right direction. Because
there are three components of this project. One is the immunization component, there is the malaria component, and there is also the knowledge agenda component. I think these three components are very key in transforming the lives of our citizens. At the end of the day, we are hoping that we can reduce both maternal and under 5 mortality by 40% in Niger State. And
the event was actually to plan for the well-being of the citizens of the state, particularly the pregnant women.
Similarly, the Honorable Commissioner, Ministry for Primary Healthcare, Dr. Ibrahim Ahmad Dangana, who is the chairman of the Impact Project in the state, inaugurated Program Implementation Unit, PIU Committee, who will oversee all the project coverage on reproductive health, routine immunization, monitoring and evaluation, social and behavioral change, to focus on successful rollout of the project across the state.
Hamza Tijaniya ya Dr. Sabu Usman Abubakar Bantu, Abubakar M. Shamsuddin, Zalia Aliyu, Muhammad Abubakar, Habibu Kimba, Umar Marafa, Adamu Abubakar Haruna, Abubakar Hussaini, Rachel Shado, Salma Yaya, and Yaya Hassan as members of the Impact Project Implementation Unit here in Niger.
Emina Zainab Halilu Kobo reporting for NSTV News.